it's 2019, 20, and 21 where we really saw these surges. And a couple of things to factor in there. One of them was the introduction of illicit fentanyl that's produced, in a clandestine lab, and they press it into a pill that makes it look like another opioid or another pill from a pharmacy, but really it contains potent fentanyl that's produced illegally. Those pills are really highly concentrated and unpredictable because that particular drug, just the physical amount that it takes to actually kill somebody is really, really minuscule. So you'd have to have, a pretty advanced chemist degree to be able to properly dose these drugs just because of how sensitive they are. So that's one thing about it. It's one of the most powerful opioids on the planet. Really, the big picture, if we start with that, drug overdoses in general of all types, whether we're talking about opioids or stimulants or alcohol, are extremely high in this community currently and over the last 3 years. So in 2019, we surpassed 300 overdose deaths in Pima County, and that was the first time that had ever occurred. I think we finished with 337. And before that, we were always in the mid 200s, still a lot, obviously. Obviously we want to see that close to zero, but, typically you would see some fluctuations of maybe an increase of 10 or a decrease of 15, or maybe an increase of 20 from year to year. But in 2019, we saw an enormous spike just from one year to the next. And that was the first year we hit that historical high. And then consecutively in 2020, we hit another historical high. So 2 years in a row. And in that year, we went from the 336 to 440 something. So we went over 300 the first year and then over 400 just in a year later, which is unprecedented. We've never seen a shift of more than 100 deaths from one year to the next. That's just an enormous increase. And this year now in 2021, those trends are set to continue, and we're poised right now for a third consecutive record-breaking year. Most of the deaths that we saw that increase were due to fentanyl. Fentanyl and methamphetamines are the two drugs that contribute to almost 80% of all those deaths that I mentioned before. So those are while alcohol and some of the benzodiazepines and things like that are part of the picture, the bulk of it is fentanyl and methamphetamines. Unusual trend that we've seen last year and this year is fentanyl actually overtook heroin and methamphetamines and became the number one drug in our community as far as the number of deaths that it contributes to. And heroin and methamphetamines have been in that spot for a long time. So it's just another kind of just a landmark event that's historical and important to mention, just the significance of it. And currently now fentanyl is 4 or 5 times more lethal than heroin, and it's totally unpredictable. So if you take a pill, normally you break it in half, you'd think, well, okay, I just decreased the potency by 50% by breaking it in half, right? I mean, that's logical based on what we know from pharmaceuticals. But in this case, because it's produced this way, there's no way to tell what the contents of a pill will be. It could be all of the dose could be contained on one side of the pill or dispersed throughout it. So there's no way to break it up and, into quarters or halves to reduce the potency because you don't know where the drug is inside the pill. So that's why you'll see that slogan a lot, one pill can kill. You would think, hey, maybe 7 or 8 pills or something like that is what is leading to some of these deaths, but it's not. We've seen people die from a half a pill, 1 pill, 2 pills the first time they take it, or maybe the 50th time they take it. And then obviously in 2020 was the pandemic year. That's a really important factor. What we know about mental health and substance use is that a driving factor is your stress levels. And so if your mental health is is not well, whether that's because you have a mental illness or you're going through something in your life that's incredibly stressful. Those things increase the risk of exacerbating mental health conditions and using drugs or alcohol to alleviate that pain. Specific to what I consider to be our highest priority, and that's minors and young adults, just because of the number of potential years of life lost with those deaths. It's much different than somebody that's been in recovery for 40 years or something in the 50s or 60s. Those are still tragic deaths, and nothing should be taken away from those. But we really have to focus on our youth. And what our surveillance has revealed recently is pretty concerning. In 2021, because of a lot of these changes, what we've recently identified is fentanyl has become the leading cause of death for kids 19 and under. So it's more than car accidents, it's more than firearms, and it's more than any other natural cause of death, and more than suicides as well. So that point in particular is really significant, because here you have something that wasn't really even in our community 3 or 4 years ago, and now it's suddenly out of nowhere the leading cause of death for our kids. Again, part of that is that it's stuck up on us. This is a really lethal drug, and kids take risks that sometimes they don't understand, and they fall to peer pressure and lots of things like that. So there's some of that is a part of the picture, but just the widespread presence of these drugs and how cheap and accessible they are is what really makes it difficult to try to manage and combat this problem. And rightfully, everyone has been concerned about COVID and keeping schools healthy and keeping the kids healthy, but it's important to point out that the most hazardous thing out there in our community really hasn't been adequately addressed yet. And I don't think that the community and the parents of the schools know enough about what's happening beyond just the epidemiology and the data and the reporting that we do and the alerts. That's important, because we got to give people information so that that they know what's out there and how to stay safe. So that's step one. But step two is then supporting them and getting resources and services in place and working with the community, especially those providers that are in place to provide treatment and support services for these populations. So we have overdose prevention services that our staff do, and we also subcontract out to other providers to do them. So that involves somebody going out and providing direct education and prevention services for people who are at risk of overdose. And we've partnered a lot with the justice system to work with people who are being released from the jail or a hospital or any sober living environment, really. And the reason for that is because anytime somebody that has been using an opioid of any kind for a long period of time, they develop a tolerance. If they wind up in a setting where they don't have access to those drugs and they've detoxed, so even if it's just been 3 or 4 days without use, their tolerance depletes. And then what happens is when they get released, if they go back to using that same drug, it amplifies the effect. So it puts them at greater risk of an overdose. So we've specifically tried to target people who are in that high-risk situation. So some of the prevention services are done at the jail or at some of the hospitals and EDs locally, even some of our residential programs. We have a curriculum of various topics that we deliver in front of kids and families. One of those is called Strengthening Families, and it's a 14-week curriculum that's delivered in front of school-aged kids and their parents, and it talks about substance use and mental health and how to have that conversation with your kids and a lot of those type of things. And then we also distribute Narcan out of the health department to our community partners and also to individuals who request it from the community. And we're in the process of purchasing fentanyl test strips. And what those are, they're a harm reduction tool that would allow somebody to say, if you have a pill that you plan to take, this would allow you to test it to see if it contains fentanyl. But we are ramping things up. We're applying for new grants, trying to get more funding in here to do some of this work.